The manufacturers of two diabetes drugs, including Ozempic, are facing a legal battle. The drugs have been used for weight loss, and now some patients are making claims about unexpected side effects, including stomach paralysis. BC Diabetes Medical Director Dr. Tom Elliott joins us now with more on this issue. Good morning. Thank you for being here.
Good morning, Kerry. It's great to be here.
So I know that drugs like Ozempic have listed side effects. What are some of the side effects, and what should be considered normal side effects?
Well, I have more than 2,000 patients on Ozempic, Kerry. There are other drugs in the class, but it's the best drug in the class currently. I tell all of them that there's a 10% chance you can't take it because of nausea and vomiting. We start with a small dose, we gradually increase the dose, and as long as you're not feeling sick, then you can increase the dose and you can expect good results. 95% of people who tolerate it get lots of weight loss, and of course we use it for diabetes primarily, and it's good for lowering sugar.
Is there a difference in the side effects someone might experience if they are using it for weight loss versus for diabetes use?
No, the side effects are identical. So everybody who takes it has that risk of nausea and vomiting.
Okay, so we're hearing about these reports of this extreme stomach paralysis that may or may not be linked to Ozempic. What can you tell us about that?
Well, the first I heard of it was, the recent media expose. And, I'm not saying it's not real. What I'm saying is that in my experience, which is great, I've not heard of it. Now, there is a complication of diabetes unrelated to Ozempic and drugs like it, called gastroparesis, and it happens after years of poorly controlled diabetes. So I think some of these people may have had this underlying problem before they took Ozempic. And then, of course, there are other problems that are unrelated to diabetes that may be causing it. So I don't think it's anything my patients need to worry about, nor your listeners.
Do you think that people who are concerned about taking this drug, hearing this, alarming news that you say it's a rare situation, rare cases that this happens, is there a way to determine if someone could be at risk of some of the more severe side effects that we hear about?
Well, now that this entity is being talked about, I think if someone's had diabetes for a very long time and it's poorly controlled and they've already got symptoms where they feel nauseated after meals, where they vomit after meals, maybe they've got gastroparesis, and I would not offer them the drug. So, I think it's much ado about nothing, frankly.
So the fact that we have these drugs now to treat diabetes has been a bit of a breakthrough, if you will. We're hearing about it, and it's being used obviously for weight loss as well, which can also lower a person's risk of diabetes if they are at risk. So is this one of the biggest breakthroughs in this area that we've seen in some time, and what's coming down next?
Okay, well, there's what I call a diabetes revolution underway, Kerry. Lots of new drugs and devices and strategies, and we have better knowledge. So Ozempic and drugs in that class are part of the revolution, and there are new drugs in the same class coming. So, Ozempic has the market now, but other companies have drugs that look very promising. So I think it's a good thing. It'll create competition, it'll lower prices, and that'll be good for the consumers who are my patients.
So in this field, what is your best advice to people who have a high risk of diabetes? What would be your advice? To take Ozempic, or are there other things that they should be doing first?
Well, my advice is always the same. I want you to be as lean and as physically fit in terms of stamina, cardio, as you can be. Everybody has an idea of what lean and fit is, and I want everybody to work towards that. With healthy eating. Healthy eating is eating, not eating when you're sad, tired, lonely, bored, or anxious. It's when it's mealtime. The food's on your plate. When the plate's empty, you push away from the table. That's healthy eating. So that's what I want for everybody primarily. And of course, I have a large diabetes practice, and everybody is doing their best. So if they can't achieve the goals they want and I want, then that's where I recommend drugs like Ozempic.
Okay, so it's going through those first steps first before taking the prescription route.
Yes.
Dr. Tom Elliott, thank you so much for joining us in studio and clearing up some of the issues and misconceptions around use. Appreciate your time.
My pleasure, Kerry. Thank you.
Thank you.